or by the defense to basically say their injuries are less severe or non-existent from those that are claimed. So first of all, they also need to understand that the provider is not treating them. There is no doctor-patient relationship. The physician cannot prescribe any medicine or suggest any treatments to the client. About a year ago, I went to a DME and the client had very bad headaches, vestibular migraines from trigeminal neuralgia and things. And her first question was, can you fix me? And the doctor said, well, that's not the purpose of this visit today. And he went on to explain, that she could come back at a later date and time and he could treat her then. So those are important things to know. I've seen several websites for law groups, and they have a whole page, how to prepare a client for a DME. And if you have one of those, that's great. I'm just trying to add a few more things that I've noticed in my experience that might help the client, that might help you prepare your client to have this be a better experience for them. So next, you want to discuss with your client what they should bring to the DME. One thing I didn't put on my list, but I want to mention in the beginning because I don't want to forget it. If they have any assistive devices, if they have a cane, if they have a walker, if they have crutches, or a sling, or a splint, or a brace, anything that they use that assists them in their daily life, whether it be getting around the house or doing certain things, they should bring those with them to the exam. I went to a DME many years ago when the lady came in, she was hanging onto her husband's arm and she was using him, whereas every other day in which he was around her house, she always used a cane. She never walked without her cane, but she was using her husband to be her cane. And that was kind of given a misrepresentation of whatever her everyday life was like. And it was really to her disadvantage. Sometimes they will ask your client to bring a list of medications if they're asked. One very important thing that I want to point out here is I typically, if you ask me to speak to your client ahead of the DME, I'll be happy to do that. But typically what I tell them is do not take your pain medicine the day of the DME. And the reason for that is the pain medicine can mask some of their symptoms and cover it up. And they won't know when some movement of their arm or leg or whatever part of the body is being examined is sore if they have pain medicine that's covering up the pain. So I tell them not to take the pain medicine on the day of the surgery. I put here a mental list of their symptoms. So what symptoms is this injury? Is this auto accident, work injury, whatever it is? What is this causing the patient? Is it causing them pain? Do they have headaches or pain or numbness or tingling? Or do they have loss of mobility, loss of function? Sometimes the clients are also asked to bring any radiology films to the exam with them. A CT scan and MRI. I was at one DME where the client forgot to bring this, but the doctor was still able to bring it up on his computer because he had access to the PACS system and could reference it through there. Your client should also have a mental list of any activities of their daily life that are affected by the injury. Can they do everything today that they could do before the injury? If they can't, they need to have a good idea what those things are and how this injury or accident or whatever event has brought them to this DME, what it is that they can't do. Sometimes the person cannot pick up a grandchild. That might be very important to them. They may not be able to play ball with, if they like to play basketball and they no longer can play basketball, or maybe they can't even toss a ball with their grandchild. What type of self-care injuries, self-care activities at home are affected by this injury? Can they bathe themselves? Can they get meals? Can they do their own laundry? Sometimes there's a flight of stairs to go down to the basement to do the laundry. And so basically, how has this injury affected their home life? Also, how has this injury affected their work life? Can they get to work? Can they still drive? If they're at work, can they concentrate like they used to? Do they have to get up and move around? Do they have to have special work conditions, a special desk or a chair or something to assist them? Sometimes people are so injured that they have to get disability allowances for them to work at home as well. So next, kind of prepare your client how they should respond. It's important for them to answer the doctor's questions thoroughly, but not to elaborate on and on and on. So first of all, they should know their diagnosis. What is wrong with them? What are their current treating providers say is wrong with them? And what is their current medical treatment? Have they had their full diagnostic testing? Have they had MRIs? Were they recommended to have injections? Is surgery recommended? Did they have that surgery? Were they supposed to go to physical therapy or occupational therapy? Sometimes people go to vestibular therapy, cognitive therapy, or even ocular therapy if they have an injury that affects their eyes. So has your client had all of the treatment that has been recommended by their treating providers? Second of all, it's important for them to inform the provider of the DME as soon as they feel pain. If they don't tell the provider that they're feeling pain, the provider does not have an obligation and probably won't write it down. And I've had physicians tell clients this at a DME: if you're feeling pain, you need to tell me, because if you don't say it, I can't write it down. They need to be honest about any previous injuries as well. If they've injured this part of their body before this particular accident or injury, then they need to be honest about that. It'll probably be in the medical records that the physician's reviewing anyways. But if they've had injury, they were totally recovered from it and they no longer had any problem with that, and then this is a new injury, that's important. And like I said before, for them to be descriptive and thorough without exaggerating. And when I mean thorough, if they're having pain, does it hurt all the time? Does it come and go? How often does it hurt? Once a week, once a month, many times a day? Does it hurt with certain activities? You know, if they do a certain activity, are they sore for 2 days afterwards? What makes the injury less painful? Are they taking medications? If they are, what types of medications? Are they narcotics? Are they anti-inflammatories? Are they taking muscle relaxants? Do they have to rest more than they did before the injury? Do they have to elevate part of their body, put ice on it, use heat? Maybe sometimes they just have to reposition. Maybe they have to go lie down. So they need to be complete with their symptoms and the restrictions of activities like I listed before. One client couldn't drive because she couldn't turn her head to the neck or her head to the left or to the right. She had neck problems, and that really affected her driving. So it really affected her daily life, how she could take care of her children, going to work and things like that. Next, when you're preparing your client, and if you ask me to accompany them to the DME, I'm going to ask you, do they need to fill out any forms? Sometimes the client will walk into the physician's office and the registration person may not know what they're there for, and they might hand them all the new patient intake forms. It might be a full history list of medications. And oftentimes, you as the attorney has made an agreement with the defense attorney that the client doesn't have to fill out any forms other than showing identification, maybe putting an address down. That the physician doing the DME should have all of their medical history. Your client should not have to fill all that in as far as when their injury was and what treatment they've had and on and on. All that should already be provided in the medical records. And last of all, your client needs to be on time. I can't emphasize this enough. One time I went to downtown DC for a DME, and the client had a car service pick her up and brought her, and the car service was late picking her up and late getting her to the appointment. They were still able to see her, but they gave her grief for being late for the appointment. I've seen some clients have to reschedule because they were 10 minutes late due to traffic. And if you've had a prearranged transportation for this client to come to the DME, or they've had a family member bring them that maybe had to take a day off of work, it can be quite a hassle for them to have to reschedule. One physician in downtown Baltimore has all his clients show up at the same time at 9 o'clock in the morning, and then he just sees them in the order that they have arrived. So if the client is late for the DME, then they're going to sit there an hour and a half, maybe 2 hours, waiting for the DME to even start. And if your client has quite a severe injury, then that can affect quite a bit how they perform if they've developed a lot of pain and they've been really uncomfortable waiting for a long time in the waiting room. The next section I'm going to go to is what I need from you, the attorney. If you want me to attend this DME with you, with your client, then I need to know that there was an agreement between the plaintiff and the defense attorney that I can attend. A lot of times they send you notice. We want your client to appear for a DME at this date and time, and you can either agree or disagree. When you agree, say, I will agree to the DME under these conditions. Then the nurse attends with the client, that they don't have to fill out any paperwork ahead of time. Sometimes these agreements have to go before a judge, and a judge has to rule on them. I've been to a DME where it was court ordered, and the physician was giving me a hard time about sitting in on the DME. And I told him it was court ordered, and so I had the attorney email it to me. I tried to show it to him on my phone. He's like, well, I can't read that. And I said, well, let me know your email address. So then I forwarded the email to him, and I heard him in his office on the phone with the attorney. I never have anybody in on here. And then the door opened, come on in, ladies. And I was invited into the DME because that was the order of the court. The other thing I need from you is the facts of the injury. I won't charge you for reviewing any medical records that you want me to review prior to going. It's just part of my prep time. But I need to know at least which area of the body is being injured. If they've recently been to a physician, had a summary of their injuries, what their current status is, that's always really helpful. If you have a complaint in the lawsuit, the complaint quite often will state what their injuries are. I also need the date, time, type, and location of exam. And you need to double check the location of the exam. I've been to one particular office up in Baltimore, and we show up at one location and they say, oh, that doctor's not here today. He's seeing patients at another office. And so then the client and I both have to get in our vehicles and we have to go to another office in order to be seen. And that delays the DME from getting started. And basically what I say to them is, we were sent here to this office, so you need to call that office and tell them that we're on our way and that we are going to be late, but it is the error of the paperwork that told us when and where to be here. It wasn't our error in being late. So I've done that ahead of time. Next, I need from you contact information if a problem arrives on the day of the procedure or the DME. What is the best way to contact you? Do you want me to email you? Do you want me to call you on the phone? If you have a cell phone number or an office phone, whatever works for you. The next thing I need is advance notice as much as possible so I can fit it into my time and my schedule. I do have some other legal nurse consultants that occasionally I can find someone to go to DME for me if I can't make it. And I realize that sometimes you get notice of these DMEs at the very last moment. It might be at the end of the discovery period and there's only a limited time. If there's any special instructions relevant to this case, if there's something special about the client that I need to know that's important, if they have a severe cognitive impairment or a speech impediment, something like that. One time I had to go to DME and the patient spoke Spanish and there was going to be an interpreter there, or there might be another person there at the DME that's also witnessing it. They might be there for the defense attorney, a case manager or something. So you might want to know what my role is when I go to DME. I'm there to observe. I'm not there to participate. I'm not there to talk to the physician. I'll talk to the client before and after the DME or while the physician or the provider's not in the room, but I won't interrupt the DME for anything. I will document how long we had to wait in the waiting room, when your client arrived, how long it took the physician to ask questions and take a history, how long the physician spent on examining this patient, and what he, not only how long did he take for the history, but what questions did he ask? I can't record this in Maryland, it's considered a felony, but I do write in my notebook as fast as I can, as much as I can get in as far as what was covered on the history portion. On the physical exam, did they test range of motion? You know, did they test strength? What did they test? Also, the provider's demeanor. How the physician responded to your client. Was he nice to him? Was he kind of gruff? Sometimes their reports sound like they're very gruff, but they might have been very pleasant to the client when they were there in the office, and that's always good to know as well. Next, I will do some writing for you. Not only do I take notes during the DME, but I will provide you with a report after the DME. I say within 2 weeks, that's just because that's my maximum turnaround time. I typically write this up the day of or the day after or within a day or two because I feel like it's fresher in my mind and I can give you more information as far as what happened at the DME. If you need it sooner because there's a mediation, I've done this before. You know, if you say my client's going to this DME on Tuesday and we have a mediation on Friday, then I will have it to you. Whatever it takes, I will get it to you. Also, I am considered a fact witness if I've showed up at that DME as far as what happened. I have been deposed once on a DME about what questions the physician asked the client and how the client responded because there were 2 accidents involved. And when did the client decide to have the back surgery? Was it before the second accident? Or were they, this particular provider was getting paid to say that everything was blamed on one accident, when typically in this particular instance, everything was related to the first accident. I can also testify in court if I need to as a fact witness. Next, as far as different types of exams that I've been to, I've had the experience of going to several different types of exams. I've been to a neurologist or a neurosurgeon where they might be evaluating somebody's cognitive status or headaches or a concussion injury. I've been to neuropsych exams. A neuropsych exam is typically a lot longer. It can take anywhere from a couple of hours. I went to one fairly recently that was 5.5 hours long. So I had a lot of notes and I wrote quite a long report in reference to that. The very first DME I ever went to was a dental DME. So this patient had gotten struck from behind and she couldn't open her mouth all the way and she had transmandibular joint or TMJ problems. And so the dentist was evaluating that. I've been to orthopedic exams, everything from a back injury, neck, shoulder, hand, finger, foot, ankle, you name it. I've been there. Also, I've been to vascular DME where somebody was injured in a car accident and their circulation to their foot was interrupted and they had permanent damage, permanent numbness in their extremity because of the vascular disruption in their body. I've been to a physiatrist where a physiatrist tested someone how much pain they were having and how this affected their daily life and what their current treatment regimen was. And they went over all the medications and everything. I've been to one where there was a life care planner evaluating a 10-year-old boy and how injured he was from birth and all the different things that were included in taking care of this 10-year-old boy. I've been to an otolaryngologist where a guy had constant ringing in his ears from an accident. So anything that you think a nurse could evaluate or a physician, I'll be happy to go there. I've been to all different exams. I live halfway between DC and Baltimore, so it's typically doesn't take me more than an hour to get to any location. I've gone to doctor's offices. I've been to a hospital office. I've met a physician in a hospital lobby, and we just went to an exam room in the hospital there. I've been to clients' homes where maybe the client is so injured that they're either bedridden or they get up to a wheelchair and it's really difficult for them to leave their home. And so the physician that's doing the DME will come to the client's home and do it there. I've actually done one at a law office where they were evaluated for not only their injury, but also for their vocational outcome. I've been to a nursing home where a gentleman got injured and he had a spinal cord injury and he had a lot of sores on his legs. That was the physiatrist that was determining what his treatment was at the current time, what type of wheelchair he would need for the future as well. This gentleman was very motivated to get out of the nursing home to recover enough to where he could go and live on his own. All right. If there's some problems on the day exam, I'll be happy to call you. If there's any special reasons why you want me to call you, please let me know and I'll take care of that. Excuse me. If your client doesn't show for some reason, or if you know your client's running late, that would be good to let me know. If the doctor doesn't show, if the exam was scheduled and that doctor's not in that office that day, or for some reason the exam needs to be rescheduled, I will let you know that. I've been to a couple of exams where the doctor wanted to do an x-ray. So I've said, well, I need to check with her attorney or his or her attorney to make sure that's okay. And usually the attorney says yes, but I will always check with you if the DME provider wants to do any further testing. And the DME provider realizes that this would be paid for by the defense. So sometimes they have to call the defense attorney to make sure it would be covered as well. If for some reason the doctor says I can't be present in the exam room after it was pre-arranged, then I will call and let you know that. I've been instructed before for both the client and I to leave the exam. We were doing this as a courtesy. It's past discovery. I was having my client come to this just as a courtesy. And if they're not going to let you in the room, then just both of you leave. I've also been to one where the doctor said I couldn't be present in the basement where this gentleman lived with his wife. So I sat at the top of the stairs and I still was able to record most of the DME and what happened. My question is, when they say I can't be present in the exam room, what do they have to hide? What are they not doing with the client that they should be doing that they don't want me to see? Excuse me. So next I'm going to go over some examples of what I have learned during the DME process. Doctors can vary. They're people. Sometimes they're very nice to the clients. Sometimes they're quite abrasive. Sometimes they can be nice or abrasive depending on what day it is. It varies day to day. I had a client one time who said that he had been denied physical therapy. And the doctor says to him, "What do you mean you've been denied care?" and really put him on the offensive. And I thought it was quite rude of the provider to actually, attack the client like this. One physician said, "I don't want anyone in the exam with my patient," like I said before, and then I would call and let you know. Once they let me stay because I had come and it was snowing outside, they said, "Well, you came all the way here in the storm. We're going to let you sit in the room." Some of these doctors can be very thorough. It might take an hour and a half for an orthopedic exam. Some are quick. The same exam might be done in about 12 minutes. It's been as quick of an orthopedic exam as I've been to. When I say some are thorough and some are not, I've been to a DME of a back injury patient. The doctor didn't even have the patient bend over or lean back to see what the range of motion of the lumbar spine was. And that was where the injury was. He focused on his upper extremities and checking sensation and the cranial nerves and all of that. I went to a knee exam probably about a year or so ago, and unfortunately, I could say as a nurse, I could have done a more thorough exam of this patient's knees and neurovascular function and circulation in his legs and range of motion than that physician did in the exam. I know it would be difficult for that doctor to say that the client was not injured if he didn't even test the area that was in question. I've had a client say to me, the last 2 times I've been here, the doctor didn't move my arm around like that, like he did today when you were there. So a lot of times my presence will keep the doctor more thorough, more honest as far as what he is evaluating. Some of the doctors will stand between the client and I when he's doing the exam, and so he's blocking my view, and he'll do the exam exceptionally fast so that it's harder for me to write it down. Other DME providers will turn and say, I measured so many degrees on that range of motion there. Did you get that measurement? Did you see that or hear that? When I say some are accurate and then there's some that don't see what I see, I mentioned before the very first DME I went to with a dental exam, this lady had her jaw clicked if she opened it too far, and then she had trouble closing it and had severe pain. And we get in the middle of this DME, and she says to the doctor, did you hear that click in my jaw? He says, open your jaw, close it. And the dentist says, no, I didn't hear that click. And I was sitting across the room and I could hear the click very clearly. Some of these physicians are very prepared and some are not. One of the early DMEs I went to, I think it was the first time I had been to this doctor's office, even though I've been there several times since. He said to the client, well, I haven't reviewed your records because half these clients don't even show up. And I thought, did you really just say that? Let me write that in my report. And then one time I went to an office and the doctor had all the medical records tabbed with Post-it notes. And I was really impressed and I thought, this guy's really prepared today. Until I went back to his office a second time and his receptionist is sitting there with a pile of medical records sticking the Post-its on. So you had a non-medical person paginating the records. If the person reviewing the records missed something in those records, then the physician wasn't going to even ask about it. The doctors, their reports can widely vary from their demeanor. Like I said before, they can be very, very nice to the client. Their report might be very negative towards your client. Other times they've been kind of short with them, but their report might be very helpful to you as the plaintiff attorney. Not only can the physicians vary, but also the clients can vary. Some of them have cognitive defects. I've been to one where this lady had an issue with a concussion and she had cognitive problems. She had an 8-year-old daughter. She was a single parent. She couldn't help her daughter at all with her homework. Her daughter was diabetic and she couldn't remember at times if she had given her daughter insulin when it was due or not. So she had to have her 8-year-old daughter help her with her medical issues. Some of the clients are very trustworthy, some are more inconsistent. One client was a physician and she was very accurate, very truthful in her, not only her symptoms, the amount of pain she was having. She had a lot of pain from her injury and the doctor was really frustrated with her. He kept leaving the room and giving her 5 minutes for her pain to calm down. Then he would come back and would start it all over again. Other clients are inconsistent. I've been to one DME where the client could hardly bend over 30 degrees because of a lower back injury. But then when I had to go and give a deposition, they showed me video surveillances of this same gentleman and he could bend all the way over in a car to pick up an infant carrier. I don't know if it was a grandchild or some family member or just he was helping a friend, but he could bend a lot better in the video surveillance than he could in the DME exam. Some of these clients are talkative and some are quiet. I usually prep them ahead of time, like answer the questions thoroughly, make sure you said what you want to say, but don't go on about it if the doctor's not asking about it. And I went to one a few months ago and I met the client in the lobby of a hospital. Every question I asked her had a 2-minute answer. And I thought this is going to be a very long DME, and it was. Other clients, we get through the DME and they'll say, well, the doctor didn't ask about this or that, when they should have spoken up and said what their injuries were. And last, I would say some of these clients I've been to are very seriously injured and have permanent injuries. And I would say that that's the majority of the DMEs that I've been to. These clients are seriously injured. They have permanent injuries. They want to get well. They want to get back to work. They want their life back, what it was like before the accident or the work injury occurred. And sometimes it's not possible because of the damage that was done to their body. Other times they just need more treatment. They need more time. But I feel like there's a lot of people out there that really want to work and really want to get better. And, you know, you have a doctor sitting here evaluating them, trying to say that they're less injured than what they are. So the last thing, when I was preparing for this lecture, and I've seen this before, there is an American Board of Independent Medical Examiners that is out there, and it's a voluntary thing that you can be a part of. So it's a voluntary process. You go to a seminar, they go over the standards, they define what the competencies are, and then they do a performance evaluation, and they take a test. They go over also the disability ratings, the AMA Guide to Permanent Impairment. So to be certified, the doctors have to have an unrestricted medical license, clear for 5 years, hold a board certification in a recognized specialty. They have to meet continuing education requirements, prove competency by passing the exam, and they have to abide by the American Board of Independent Medical Examiners Guidelines of Conduct. So out of curiosity, I decided I would look up the physicians that I've been to for DMEs. Out of all of Baltimore, Washington, DC area, I found 3 physicians that had this certification. So I thought that would be kind of interesting to ask this of the physician, either in a deposition or in trial. Are you familiar with this board? Are you a member of it? Why or why not? You do these every day and you earn X amount of money doing defense medical exams, but yet you haven't been through and been certified by this American Board of Independent Medical Examiners. That was just something I thought was interesting. That concludes my presentation. I want to allow some time for some questions. So I think I'll let Mary pick up from here, and she's going to field some questions.
Thank you, Marcia. That was very, very interesting. I always learn something on these webinars that I attend, which is really, really helpful. If anybody has a question, go ahead and use the chat feature at the bottom of the screen, and I can go ahead and read it out to Marcia, or she can see it and answer your question that way. So we'll wait a few moments. Okay. Jonathan has a question. What is the biggest mistake a client makes at a DME?
Either saying a little bit too much or not enough, I would say. And sometimes it's hard for them to understand. They may have forgotten something that's really important to them that they can't do. But just being on time and answering questions truthfully and honestly, I think is the best that they can do. And, you know, I didn't say this in my lecture. You might not want me to attend every DME that all of your clients go to. I totally understand that. But you might have that one client that one specific case where you're concerned about how the DME is going to go. Maybe it's a physician you're unfamiliar with. Maybe it's a client that you don't know how reliable they'll be as far as answering the questions. They may have a brain injury or cognitive injury that may impair them from answering some of the questions in the exam.
Well, Marcia, I have a question myself. So say if you go on one of these and you know that a client has a specific issue and that client forgets to say it, are you able to prompt them? Would you make them leave the room with you, prompt them and have them come back, or you're not allowed to say anything?
I would prompt them if I thought it was something really important.
Okay.
Usually try not to interrupt, but if it's important to them and they said ahead of time, like I can't pick up my grandchild, and if they say, oh, I'm nervous, I can't remember, then I could say, well, you told me in the waiting room A, B, or C.
Okay, well, that's very helpful. I assume, Marcia, you will make this PowerPoint available to anybody who wants it?
Yes, what I'll do is I'll email it to you, Mary, and then you can send it out to anyone who came to the webinar.
Fabulous, okay. Does anybody have any other questions? Wait a few moments, let people type. Yes. Do you see that? There's a few questions coming, Marcia. Can you read them or you want me to read them?
Go ahead, I don't have the chat box.
Okay. All right, so James is asking, I'm wondering if you would have expert status based on your training as a nurse. Also wondering if your report would be discoverable.
So the answer is yes, my report would be discoverable because I would be a fact witness, but I would be considered a fact witness as opposed to an expert witness. I mean, you could bring in my nursing expertise in that I've attended medical exams before and that I'm familiar with basic anatomy and physiology and how to assess certain things in the body. But I'm basically a fact witness when it comes to attending a DME.
Okay. And Juan has a question. What are some key instructions, differences, physical and mental examinations in your experience? Otherwise known as, what are the pitfalls for mental examinations?
So you want your client to hopefully be on a good day, not to do something that's real stressful for them the day before the DME. If they're capable of just short segments of things, they shouldn't be spending the whole day shopping or be spending the whole day house cleaning if they have a lot of pain and that affects their physical injuries. So maybe just rest quite a bit the day before the exam so that they could be their best.
How about for mental injuries?
For mental, so sometimes clients get up and if they're having a headache that day or they're having a lot of pain, then they may have felt the need to take something, then they may have, and that's perfectly fine. The DME provider is going to find the client the way they are on a day-to-day schedule, and it might be a good day and it might be a bad day. Either way it is, they should still go to the DME and do their best.
Any other questions? Any other questions? Okay. I think that's it for now. If you do have any other questions, Marcia has left all our information here and you can certainly always contact me. But other than that, we're gonna sign off and I wish everybody a wonderful weekend. Marcia, thank you for your time today.
You're welcome. Thank you for being present.
Okay, bye-bye everybody.